A lot of women ignore these symptoms I actually want to talk about right now because it feels completely harmless. But then most of you who are having these symptoms do not even know that your body is just struggling. And the scary part of it is that you may actually be having this symptom right now and you are brushing it off. So listen to the end. Number 1, that feeling that you're being bloated all the time. Not the one that comes after you've finished taking a very heavy meal and then you feel bloated. You know what it means? Like you're getting pregnant. So you're having this tightening around your tummy. Even when you've taken a little meal, you feel tightening around the lower part of your tummy or the upper part of your tummy. And every day, the clothes that are loosening, they begin to tight you around your tummy. So when this is happening persistently every day, so it means that your body has gone into the permanent full setting mode. Your body is not meant to feel pregnant or bloated every day. When you're having such persistent bloating, it could mean that you're having buildup of fluid inside your tummy, or you're having some masses or some growths pressing inside your tummy. And sometimes some women would go and be taking Gestate or even some herbs. So when you belch, you think that you're actually okay. No, you're not okay. Or sometimes some hormonal imbalances could actually make you feel that way. Conditions like ovarian cysts, ovarian masses, or some other conditions inside the abdomen or in the tummy can really make you feel that way. So get yourself checked and stop taking Gestate, Mismark, or some herbs so that you can belch. That doesn't solve the problem. Know what is going on inside of you. Number 2, that feeling of I feel full very fast. Now you're taking your favorite meal and you're just taking some bites in between and you're already feeling full, unexpectedly full. When you feel like this can actually happen in some conditions when you're having some masses growing inside your tummy, and this is not allowing your tummy to really expand when you're eating. That could mean that you could have ovarian masses or some abdominal masses or some chronic disease conditions that could make you feel that way. It's just like you're trying to fill water in a water bottle that is half filled with water. So half the way you're completely filled because something is completely occupying the space. So you need to find out why you are feeling that way. Number 3, that feeling of I am losing weight without even trying. Now it sounds like a blessing, right? But if you look at it very well, in the right sense of it, it may not really be a blessing. It's just like your body trying to run a marathon that you're not aware of. For you to lose weight, you have to be intentional, either through exercise or diets, etc. And then you can achieve weight loss. So when your body is doing that, when you're not subjecting your body to intention and you're having an unexplained weight loss, when you're having unexplained, unintentional weight loss, it could simply mean that your body is trying to fight some kind of disease conditions or inflammation and you don't even know. This can be linked in conditions like thyroid disease conditions, infections, chronic disease conditions, or sometimes even cancer. I'm not trying to scare you, just to inform you. So please get yourself checked when you're having an unintentional or unexplained weight loss. Number 4, that feeling of I am tired all the time. So to you, it may feel like it's a soft life or you're trying to be like a baby girl, but please, you have to watch it. When you are persistently waking up in the morning, you feel tired, you sleep, you wake up, you do a little activity and you're feeling tired. It's just like you are charging your phone for almost 20 hours and you go and you see that it's just 10% charged. Something is going on inside the phone or with the battery. So you need to know exactly what is happening when you're having such kind of tiredness. Most of the times it can be due to some conditions like anemia, your blood is low, or some chronic disease conditions, or even some thyroid disease conditions, or some medical conditions can actually make you to feel that way. So you need to really get yourself checked because something is really draining your energy levels that you cannot really explain. Number 5, that feeling of just back pain or pelvic pain, and it keeps coming constantly. You keep blaming your chair, your mattress, or you're blaming your sitting position. But one thing about pain is that pain is not random. It's actually a communication. When it gives an alarm once, you could ignore that. But when the alarm is blowing all the time, then you have to pay attention. Such pain could mean a lot of things going on inside your pelvis or in your body, like when there's an inflammation, when you're having some tissues in abnormal places and it's giving you some pain, like in conditions like endometriosis, adenomyosis, or even fibroids and some other pelvic conditions could be giving you that long-standing pelvic pain that you think is about your chair or your mattress or your sitting position. So go and get yourself checked. Number 6, it was just a little spotting that I had after sex. Now, this is something a gynecologist would take very seriously, even if it happens just once. When you're having a sexual contact with someone and you spot or you bleed, it's not something that you can just ignore because your cervix is not supposed to bleed after contact. It's just like your skin bleeding when someone touches your skin. That is what happens when you bleed or spots after a sexual contact or after sex. It can be caused by certain conditions like inflammation, infection, growth like cervical polyps, or even in some conditions like cervical cancer. So that's why you can't just normalize that as if it's nothing. Number 7, that's feeling, oh, my period has stopped. And after 2 years, I still see my periods again, and you're in your 40s. Now, when your period has stopped, particularly when you're advancing in age, like in your 40s, and you've not seen that period for 1 year, it has ceased for more than a year. So you are already menopausal. So that means that the womb is no longer active. So when you begin to bleed again, it's like the body that has shut down just restarted in a very negative way. So at that point, you need to get checked, because such kind of bleeding, we call that postmenopausal bleeding, could be linked to abnormalities like within the lining of your womb called endometrial hyperplasia or endometrial thickening, or even sometimes could be linked to endometrial cancer or even cancer of the cervix and some other conditions of the reproductive tract that are sinister. So you need to get yourself checked. So here is the truth most women do not even know. The body does not send random symptoms. It sends you signals, it sends patterns, it sends warnings. So do not ignore the signals, the patterns, or the warnings and begin to normalize them. Because if you do that, you may have to pay attention to that in a very terrible way in the future. Please like and tell me what you feel about this video. And don't forget to invest in your health by subscribing to my health channel. Thank you, and see you in another video. Dr. Tukwins is always here to guide you.